The goal of foster care is for the child to be in a safe and nurturing home while the parents have a chance to work on whatever circumstances led the child to be in foster care.
So the goal of foster care is to care for the needs of the child, make sure that they're safe with the goal of returning them, if at all possible, to their biological family. So there are various different situations that could put a kid in foster care, but really almost all of the scenarios, the setup around them, DHS, the medical system, the goal is to return the home to a healthy place and then allow the kid to be back in that home.
So the goal of the child welfare system at large is really the protection, safety of children, as well as providing permanency for children, ideally with their own families, but if not, into adoptive families, and then the well-being of children. Specifically, foster care is really a program that's designed for children who can't be maintained safely in their own biological home and need to live somewhere with a safe family while the child welfare workers and the court work with that biologic family to see if they can improve the home conditions and make it safe for a child to return home.
Children in foster care can be placed in a traditional foster home. They can also be placed in a kinship foster home, which would be a relative or someone who they already have a relationship with, or they could also be placed in a therapeutic foster care home for children who need a higher level of care.
There's several different types of foster care placements available in Oklahoma. The most common are traditional foster placements, which are just homes who have opened. They don't have any prior relationship with the child coming into their care. There are therapeutic homes, and they take either children they're related to or not related to who need a higher level of care, who have just special needs. Those homes get a little more training. And there are kinship placements, and those are people who are either related to the child coming into their care or are family friends or otherwise know about this child, have met them before.
Then occasionally we will also have children who are placed in non-family settings, such as group home settings or even inpatient psychiatric facilities or even shelter settings, where we don't have at that time a family who fits with the needs of that child, or possibly that child is requiring a higher level of care, meaning people need to be awake 24 hours a day, so that requires a facility where there's staff rather than a family home.
Kids are placed into foster care for a variety of reasons. Most commonly, they're placed into foster care for neglect or abuse. Neglect usually is just physical neglect. Parents or caregivers weren't able to provide just the physical everyday needs that kids need to be safe and healthy. Kids who come into care for abuse often have physical or sexual abuse, or they've been sexually exploited, have been involved in sex trafficking. Anything along those lines would be excellent reason for you to need to be in a safe place like foster care. Kids also come into care for a variety of other reasons. Occasionally it's that their caregivers have died and we're trying to figure out where they are best going to be placed for the long term. Maybe that they were exposed to domestic violence or to drug abuse from their parents. Just any number of reasons, basically anything where a kid is just not being properly cared for.
The average number of foster placement a child experiences in Oklahoma is 3 to 4. That being said, there's quite a bit of difference from child to child. So there's quite a lot of children who may experience 1 to 2 placements, and in fact, reducing the number of moves for children is a huge priority to Oklahoma's child welfare system right now. There are a lot of efforts in place to do that. That said, there's also a population of children who may experience more than 4 placement moves, and in fact, the average youth who's in foster care may experience as many as 8. I've personally seen children who've experienced as many as 25 to 30 different foster homes. There's a lot of attention on trying to not allow that to happen, but occasionally we have children like that. And as a provider, it's important for us to understand if children are stable or if they're moving around quite a lot, because it has a tremendous impact on our ability to treat them with any kind of sense of a follow-up plan or ability to assess the effectiveness of our treatment. It also may help us understand some of the complaints that we may receive, particularly around behaviors that are challenging because of trauma or because of the disruption of moving around from place to place.
There's a number of different roles in the foster care system, but the most important for our setting are the foster family, or perhaps the group home, whoever's taking care of the kid, the caseworker who's assigned. It's usually a permanency worker, is something you'll hear quite a bit. They're the ones who are having the long-term role in the child's case. The judge, who of course is making all the orders, giving consents for certain things. There's a medical provider, and then there's people like me who are the social workers here in the facility.
So one important thing to remember is that foster children are first children. So anything that a child with a completely normal social home life could have, a foster kid could also have. But there are certain things that are more likely in foster children than in others. Behavioral problems are almost across the board. The children that are in the foster system, by definition, have gone through adverse childhood experiences. Most of them a large number of adverse childhood experiences. So behavioral issues are very common. Psychiatric and psychological issues are more common. Maybe one of the most important things to sort of consider is that children that have had histories, particularly traumatic histories, can often present with symptoms that look like ADHD, inattentiveness, hyperactivity, impulsivity, but in reality what they're having is PTSD. And unfortunately, when we treat their ADHD, not only will those symptoms not get better, they will often get worse. So it's just good to recognize that some of those past experiences that they've had may actually make that set of symptoms be a completely different thing.
Providers need to be just aware that these kids are experiencing trauma, and that first visit especially is usually within 30 days of them being removed from their family. They are probably pretty sensitive, still don't quite know what's going on with their life, and that's terrifying for a kid, terrifying for anyone. So we need to be particularly sensitive to the fact that they may be scared of exams, they might be hesitant or just outright refuse genital exams, they might not be able to do vaccines or be able to do things that seem like pretty simple procedures. So anytime we can put that off and it's appropriate medically, we need to just be sensitive and put that off a little, let them come back in a few weeks or a month when they're feeling a little more up to it.
Here.
A child in foster care should be seen by their medical provider soon after they're placed in a new home, and then again after about 30 days if everything is going okay, just to follow up and gather up their past medical history and any new information that may be available. And then throughout their placement in foster care, children may need more frequent visits than other children do to follow their medical problems, for developmental surveillance, and other mental health and healthcare surveillance. One of the challenges of providing health care to children in foster care is finding their past medical history information and also obtaining medical records. There's several ways to go about finding medical records. First, you can contact the child's caseworker who can help you coordinate getting medical records. There is also a child's health passport on the Oklahoma DHS website that the foster parents are able to log into that may have useful information. And sometimes you can find information about previous providers on the child's immunization records or prescription medications that may have arrived in the home with the child, and send medical records requests to those other providers.
There are 2 or 3 primary people involved in a child welfare case who may have the role of advocating for that child and would be the best points of contact for a medical professional if they have a concern or they're trying to advocate for their patient. One of those would be the caseworker, because the caseworker's job is to watch out for that child. And the child will have a specific caseworker assigned to them. Often that's called a permanency planning caseworker. But identifying who that child's caseworker is, who comes and visits them every month or checks on them, that would be a great point of contact for medical providers, and really something we should try to capture at our visits and include in the social history or somewhere in the medical notes so that it's easy for us to figure out how to contact them. A second advocate that can be present in a child welfare case would be a CASA, which is a court-appointed special advocate. CASAs are community volunteers who go through some training and can be assigned by the court or sometimes requested by families or foster families to participate in a case. And those volunteers are really there to have eyes on the child and ensuring that the child is getting what they need. Additionally, the child may have an attorney. The attorney has more of a court role in terms of advocating for the child. And then finally, the district attorney or the judge may also have a role in that, especially in terms of things like approving certain kinds of medical procedures, medical consents, etc. But for sure, for the typical kinds of advocacy we do, caseworker, CASA, and child's attorney would be the most important starting places.
For kids in foster care, who can give consent is always a big topic around the hospital, and it can be a little tricky to figure out. The general rule is that anything that is routine care, anything that happens here in clinic, like scheduling appointments, giving vaccinations, ear washes, those little procedures, those can be consented to by the foster parent or by the shelter who has custody or has placement of the child. If it's bigger than that, it's a procedure that involves sedation or anesthesia, we need to get the caseworker involved because typically the judge will have to order that be done. And those can take some time to get the order. They're often not things that can be done very quickly. So if possible, give as much notice as you can to either me as a social worker or to the caseworker because they're going to have to get information given to the judge.
Placement providers don't know what these kids have gone through. It's tough. Kiddos are in a new home with strangers. It's hard. It's difficult. All they want is to be back home with their parents. Honestly, just providing the resources, the help they need, the therapy. And I've also, explained to placement providers they need to find somebody that they need to talk to as well because they're going to be hearing some stuff from kids that's going to be heartbreaking, and it's tough, and a lot of the placement disruptions that I have seen is because of the behavior of the children. If the foster parents understand why these behaviors are happening, then maybe they can figure a way to help them to prevent them being bounced around from home to home. It's as simple as a completed clinic note within several days of the child being seen in clinic with very specific recommendations if the child needs to be seen by specialists. Also, having a updated shot record is ultimately best. Honestly, DHS, permanency workers, and parents are on a time frame with judges. There's dates that the judges set. Honestly, if you see a request come across your desktop for medical records, lab reports, clinic notes, anything in particular, a simple phone call, please get to it as soon as possible. It really helps the workers produce the information for the judges in order for them to make the decision whether these kids can go home in a timely manner.
The Fostering Hope Clinic at OU Children's Physicians is a primary care clinic for children who are in foster care. You can contact us at 405-271-6827.